Imagine you hear an alarm coming from your patient's room. You arrive promptly to handle the issue to find that the patient's family came to visit and he was very excited to see them. He was hugging everyone, including his grandchildren. The cardiac alarm started to sound because his heart rate had increased due to his excitement. 1 hour later, the patient's family has left and you are charting at the station when your phone alarms. You quickly silence the alarm and continue charting. 10 minutes later, you remember the alarm and go in to check on Mr. Jones. As you enter the room, you find Mr. Jones unconscious, unresponsive, and with a heart rate of 25. Mr. Jones was unable to be resuscitated and died. What went wrong, and what could the healthcare system have done differently? Boston Hospital has the answer.
Boston Medical Center, now a national model for patient safety.
The hospital leading the charge when it comes to reducing alarm fatigue. That's when constant beeping alarms desensitize nurses and then put patients at risk.
Okay.
No need to turn your volume up. This Boston Medical Center floor really is that quiet.
We've been on the unit here for 15 minutes and we haven't heard one alarm yet.
Now compare that to this.
And that's one patient. If you amplify that times 24 patients, the noise is deafening.
Coming in at a whopping 90 decibels, equivalent to heavy road traffic.
Where's on staff?
Most beeps, false alarms, all requiring nurses hear the difference between a 2-beep warning and a 3-beep crisis in among 90,000 other alarms each week.
It's not just the monitors, it's the beds, the call lights, everything. And you have to be able to figure out where it's coming from and where you're going to go to next.
It's no wonder alarm fatigue, when nurses become desensitized to the constant beeping, was again named the top technology hazard facing hospitals, responsible for dozens of deaths each year.
There are incidences where staff didn't hear a critical alarm or didn't respond to a critical alarm in a timely manner.
It's so dangerous, the Joint Commission made reducing alarm fatigue a national patient safety goal this year. The stakes? Hospitals must turn down the noise or risk losing accreditation. Boston Medical Center is their model for change.
We made some aggressive changes.
Simple, yet wildly effective too, and already in place throughout the hospital.
It got incredibly quiet. So quiet, in fact, that they thought the system was broken.
Adjusting manufacturer defaults on equipment so alarms sound only when there's real danger.
And it reduced the noise greatly. It went from about 90,000 alarms a week to just over 9,000 a week.
That's a stunning 89% drop.
The most important thing is they now have the time to spend with the patients and not answering meaningless alarms.
BMC was also recently the focus of a Joint Commission webinar seen by more than 1,000 hospitals across the country, teaching hospitals how to fix the problem.
Boston Hospital is a national model for reduction of alarm fatigue. Another study, called A Team-Based Approach to Reducing Cardiac Monitor Alarms, was published by the American Academy of Pediatrics. This study addressed excessive cardiac monitor alarms, which led to desensitization and alarm fatigue. They created and implemented a standardized cardiac monitor care process on a 24-bed pediatric bone marrow transplant unit. The aim of this project was to decrease monitor alarms through the use of team-based standardized care and processes. Those processes include a process for initial ordering of monitor parameters based on age-appropriate standards, just like we saw at Boston Hospital. They also included daily replacement of electrodes, daily individualized assessment of cardiac monitor parameters, and a reliable method for appropriate discontinuation of the monitor. From January to November of 2013, percent compliance with each of those 4 components increased. Overall compliance increased from a median of 38% to 95%. During this time, the median number of alarms per patient day decreased from 180 to 40. Now let's look at how this evidence-based practice would have benefited our patient, Mr. Jones. Upon hospital admission, his healthcare provider would set his monitor parameters based on his age and condition of disease, not the manufacturer's predetermined setting. This would allow for a decrease in unnecessary alarms. It would then be the nurse's responsibility to update the staff about changes in his plan of care. When the nurse hears the alarm coming from Mr. Jones's room, she responds immediately because she knows that alarm is critical. When her hospital implemented this evidence-based practice, false alarms went down 85%. Alarms are now recognized and responded to much more quickly than before. She rushes into Mr. Jones's room to find him unresponsive. She calls a code blue and immediately begins CPR. This rapid response to the critical alarm was vital in saving Mr. Jones's life. As we saw earlier, alarm fatigue has been linked to negative outcomes. By reducing the number of alarms, we can improve patient outcomes, increase nurse-to-patient interaction, and improve efficiency on the floor. In 2014, the top technology hazard facing hospitals was alarm fatigue. This was responsible for dozens of preventable deaths each year. The Joint Commission made reducing alarm fatigue a national patient safety goal. This evidence-based practice could be a matter of life and death for your patients.